are you taking too many medications?
A lot of people are. Some of our viewers probably are.
We're talking about deprescribing. Okay, you've heard of prescribing medications. Now we're going to talk about deprescribing.
Okay, not unprescribing.
And we see this all the time when we admit a patient or we're going to operate on a patient. We take down their history and record all the medications they're on. Often people are on a lot of medications.
Sorry, people come with a big bag of pills.
A big
when
bag
they don't
of
go
pills.
on the desk, you're like,
Yeah, that's a lot.
of pills.
So, and you may need all those medications.
Yep.
However, you may not.
Right.
Okay. So what is deprescribing medication?
So deprescribing is a very intentional effort to reduce or assess and potentially reduce the number of things that you're taking.
Right, and this could include medications like blood pressure medications, diabetes medications, or even supplements like different vitamins.
And
you
there are
might be
so
taking.
many nowadays.
Now, of course, you don't want to do this on your own. You do this with the help of your healthcare professional.
For sure.
And the reasons you might get off of certain medications
Are many.
Right, maybe you were taking medications for blood pressure, however you've altered your lifestyle, and you don't need those medications anymore.
Right, now you're getting dizzy or you're feeling faint.
Right, nobody wants to feel faint.
No. Or maybe you're spending a lot of money on medication and you don't have insurance, or maybe you're taking a lot of supplements that aren't necessarily doing anything for you.
Or maybe you have so many medications that it makes it hard for you to be compliant with taking your medication. Instead of taking 10 pills, you only have to take 3 pills. It'll be easier to comply with that.
Like your dosette is too full. You can't even get the lid closed because there's too many things in that little box.
You got no room for lunch.
Okay.
Often when we age, the way our bodies metabolize these medicines change, so we might even just need a dose adjustment or something like that. Okay, so is it safe? Is it safe to do this? Just to stop medications you've been taking all your life?
So it depends on what it is. So yes, often it is safe, and you may have to wean down your dose potentially rather than stopping abruptly. But definitely, it's safe to stop taking some things for sure.
Only with the help of your healthcare
or your pharmacist or whoever.
Examples of medications, like we mentioned, it could be medications for your diabetes. Maybe maybe there's newer medications out there. Maybe you've changed your lifestyle such that you don't need so many medications.
Maybe you had a blood clot and you're supposed to take a blood thinner for like a year, and then you're supposed to stop it after that, and all of a sudden 6 years later you're like, I don't even know I'm on this thing anymore, and I see that all the time.
Yeah, I see that too. People are like, wow.
I'm like, why are you taking this? They're like, I don't know.
Because the doctor told me to.
That's right. And your family doctor's busy, so you go in, you have typically an acute complaint, and maybe you don't have time for the proper full medication review, which is critical.
Right, and that's just it. We talk about going to your doctor to get a checkup or to get some blood work done. Now we want you to go to your doctor for a medication checkup.
Right, because these things actually could potentially be harming you.
Yeah. And we didn't come up with this on our own. No. I saw this published in JAMA.
One of your favorite.
JAMA? Journal American Medical Association, the Internal Medicine Department, and they put out a sort of patient information page that said, hey, think about going to see your healthcare provider and reducing the number of medications and supplements and all that you're on. Now, you might need them all. You might go in and say, yeah, you need all 14 of these medications. Fine, at least you tried. But I bet you any money, you're going to go there and at least be able to get rid of a couple of medications.
So for all the viewers who say, hey, you guys are pro Big Pharma, there you go.
Here you go. Take that, Big Pharma.
Take less medications. There you go. Now you know. Talk to your doctor about this. It's really important. If you like this video, please like and subscribe to our channel.
And remember, you are in charge of your own health, and you're in charge of the medications you take.
We'll see you next time.